Hi, it's Dr. Queen again. I want to talk about some of the things that you can do for your allergies at home before you even seek medical attention. Because there's a lot of over-the-counter medications that you can try first before you come in. For example, nasal steroid sprays are probably the best medication that you can take on a regular basis for allergy symptoms. They're available over the counter. There's many brands out there, and there are generic versions as well. They'll work on nasal congestion, runny nose, sneezing, post-nasal drip, sinus and ear pressure, scratchy throat. Most of the allergy symptoms can be controlled with nasal steroid sprays. Like all medications, they don't always work, but they're good things to try. Only a couple of contraindications. If you've had problems with nosebleeds, then you shouldn't use nasal steroid sprays. They sometimes can give you some headaches or some burning nose, and just stop them. Those symptoms will go away. Don't fear them because they say steroids. A lot of people are afraid when they hear steroids, but nasal steroid sprays are not absorbed into the bloodstream. They're just topical, so they won't have steroid side effects. Antihistamines are also commonly used. They're primarily for the histamine symptoms, which are going to be the runny nose, the sneezing, the postnasal drip, itchy, watery eyes, primarily the runny and drippy postnasal drip. And there's two major classes of antihistamines. There are the sedating and the non-sedating ones. And there's a few that don't make you sleepy, and they're best to take in the daytime or if you're driving. There's some that also have a little sedation that may help you sleep at night. Then there are even some intranasal antihistamine sprays that are available now over the counter as well. Have a little bit of a bitter taste, but they work very well, and they work much faster than the pills because they're going right where you want them to be. There are decongestants. Decongestants mostly are behind the counter. You usually have to ask for them, but there's a couple that are available over the counter. They will primarily work on the congestion, sinus pressure, ear pressure. The thing to be concerned about with decongestants are just make sure you don't have any heart or blood pressure problems. If you do, you should not take oral decongestants. Also, sometimes they can give you trouble sleeping, for example. Let's see, you've got mucolytics are available over the counter. Also, that thick mucus. So if your postnasal drip is not the runny, drippy, but more thick and pasty and kind of hanging up in your throat, they're nice for cut. Some of them also come with cough suppressants as well. Nasal saline. People forget about salt water. Nasal saline. There's no medicinal value. It's like washing your hands. You're just cleaning out your nose, getting rid of the mucus, and it helps with congestion, and runny nose and postnasal drip. So these are some of the things that you can try first over the counter before you come to the doctor. And then we could talk about prescriptions at that point.